I welcome us all to the National Strategic Plan of Action on Cholera.
NSPACC envisions a Nigerian population free of cholera disease and cholera-related death.
Cholera remains a major public health concern in Nigeria, with outbreaks occurring frequently in many parts of the country. However, with this plan, we are taking proactive steps to prevent, prepare for, and respond to cholera outbreaks.
The launch of National Strategic Plan of Action on Cholera Control 2025 to 2029 reaffirms our collective efforts to eliminate cholera and create a healthier and safer Nigeria.
The National Strategic Plan of Action on Cholera Control aligns with the Global Task Force for Cholera Control, Ending Cholera, a global roadmap to 2030. The roadmap is a testament to our commitment to ensuring Nigeria meets global water, sanitation, and hygiene WASH standards, which are critical pillars in cholera prevention and control.
On behalf of the federal government of Nigeria, the subnationals here represented by Enugu State and Bauchi State, the Federal Ministry of Water Resources and Sanitation, Federal Ministry of Environment, and the Federal Ministry of Health and Social Welfare. On this day, 4th of February 2025, launched the National Strategic Plan of Action on Cholera Control, NSPACC 2025 to 2029, on behalf of the government of Nigeria, our development partners, and to the glory of God, for a free country rid of cholera. To the glory of God. Thank you.
So now that the plan is launched, what lessons would you love to share about the process? How do you see that this coordination would proceed going forward?
The story around cholera actually started as far back as the early 70s. And today, we are showcasing 134 cholera hotspots from 21 states. It's highly disheartening.
Nigeria has had its own share of vaccination, both reactive and preventive. So our question would be, we know there are challenges around this, so we'd like you to just shed some light around the challenges, the global situation, what you think we need to do as Africa, being the highest burden continent, to be able to be vaccine dependent, particularly when we speak about OCV. Thank you.
One of the challenges with the vaccines is that there's actually severe global shortage.
Cholera is preventable, and perhaps the quickest way to prevent it is to ensure that people have access to sustainable, safe wash.
What lessons do you think you can take from the Zambia experience, both in terms of addressing cholera, but also in terms of engagement up to the executive arm?
In order to prevent and ultimately eliminate cholera, it has to be done not at the national level, at the community. It has to happen at the community.
The Partnership for Water, Sanitation and Hygiene, partnering with the states, the local government and the federal government and the development partners to be able to increase access to water, sanitation and hygiene.
So encouraged today by the representation in the room. It's multi-sectoral, it's multi-level, and it's showcasing how the authorities in Nigeria have committed to lead this effort.
You really need to see what is happening to people around our communities It was a very, very traumatic and emotional experience during that documentary when we videoed it.
We need to share information because it saves lives. And cholera is only as powerful as we allow it to be.
Come together and unite in the fight against cholera, which Nigeria is very committed to.
Today, for me, is like a dream come true. It's a baby that we've been carrying for over 3 years now. And today, I'm happy to see that it's been launched.
Together with our colleagues in Nigeria Red Cross and 800,000 volunteers in the country, we help spread that message that we need to end cholera in Nigeria now.
We support across all the 8 pillars that are identified in this strategic plan, but mainly our support is on the case management. We also support with the social behavior change, that is the community awareness and demand generation. UNICEF heavy investment is on the water, sanitation and hygiene. So we do have all the services, including the cholera vaccine, that what the Ministry of Health procured through UNICEF.
This is a development that we've been tracking at the embassy very closely. The health sector is a big priority for the Belgian embassy here, so we very much look forward to the conclusions of this report.
We appreciate all the great works we've put into getting to this stage, but we are committed to ensuring that this is just not like any other document. The lies follow on the shelves. We want to hit the ground running, and then that's why we are prioritizing advocacy and resource mobilization to be able to implement the components of the plan, which we are very positive that it will help us to achieve our desired goal of at least 1% or less than that case fatality rate from cholera, and that we want to reduce mortality, that is death, from cholera by 90% by year 2029. And we believe this is possible with the commitment of all the stakeholders here today.
For outbreak prevention in the longer term, what we really need to invest in is an early detection system so that we detect cases very early and are able to respond very quickly. But even more important is to put in place the infrastructure that protects our people from catching the disease in the first place. So that means investment in water, sanitation and hygiene.